labs across in China. This lab here, this is the 14th floor. It's my hospital. The lab located. And this is at midnight. All lights you see here. So we have to work late night, almost every working day. So it's too busy. And this is a survey of procedure time by Chinese electrophysiologists. So EP procedures begins after noon, it's up 10%. And finishing working time after 9 p.m., 25%. And so working hour length in EP lab, more than 12 hours a day, 36.9%. So it's a really heavy burden for electrophysiologists in China. And this is a survey across China about occupational body pain in interventional cardiologists with the lead gown. So this is interventional cardiologists. The incidence of body pain much severe than interventional cardiologists. The AF ablation recommendation level continues in growth. In the last 20 years, we have witnessed. And the fluorous cardio EP lab is feasible with the supporting technology, contact force sensing catheter, intracardiac echo, and a 3D navigation system. Especially eyes provide very important role in this aspect. How about the development of green EP, the zero fluoro EP procedure in China? In the 2022, the Chinese Green EP Lab Project Task Force was founded, and this task force has routine meeting, meeting routinely every year since then. And this is the first expert consensus of fluorless cardio EP lab, which was published in PACE. And thanks to Dr. Paul Z with his contribution to. And this year in Boston HRS, I introduced the Chinese expert consensus on zero fluoro EP lab in a TV show. Actually, in developed country like the States, the FDA approved AF ablation can be done without fluoro. And in China, many EP centers began to build a fluorless EP lab to meet the demand of their working flow, the volume of patients. The different centers here. Now let me talk about the daily practice of fluorless cardio EP lab in my hospital, so Ransha Hospital. This is our lab. You can see no DSA machine, and with a big screen, and actually the tracing is much cleaner than the one in lab with the DSA machine. And before the procedure, as we know, the acute tamponade, it's nightmare for in the lab. So for for each patient before the procedure, we will do pre-procedure ultrasound to detect the length from the xiphoid to the pericardium and the direction, etc. Also, we check the iliac vein patency and the inferior cava patency to make sure the femoral approach is possible for the patient, because in the non-fluoral EP lab, without fluoral, we can't use the wire to test the access to the right atrium. This is a procedure preparation for pericardiocentesis. We measure the distance from the xiphoid to the pericardium space. And also, we use ultrasound-guided femoral vein puncture to reduce the complication of puncture complication like hematoma, and AV fistula, and pseudoaneurysm, arterial pseudoaneurysm. And we use electrified J-wire transeptal puncture guided by ice, which is very accurate and safe. So with the ice, now heparin will be given after successful venous puncture and before transeptal puncture. And with ice, we can do transeptal puncture where we want accurately. This is our workflow of fluoroless AF ablation. First, we use ice, advance ice to the right atrium to make sure that the home view is seen. Then check the thrombus in the appendage and check the baseline pericardial effusion, and then do matrix of the right atrium and the coronary sinus, and create the geometry of left atrium. Then do transeptal puncture with the Bovi directly. And then do AOA geometry creation and substrate mapping of the left atrium. Also, etc. Do PVI plus, and monitoring the complications. This is our workflow. And actually in our country, in China, many efforts have been done to promote green the zero fluoro technology, EP technology. We set up a standardized requirements and the configuration. This the lab, the area usually 30 to 60 square centimeter to meet the requirements of procedure, multidisciplinary rescue, and patient transferring, and etc. And this is a workflow for different kind of procedures in the zero fluoro lab. This one is for AF ablation. We right femoral vein approach is preferred, and then introduce ice to the right atrium to guarantee the home view is there, and then do transeptal puncture, etc. After all PVI plus was done, and during the whole procedure, monitor the complications and like pericardial effusion and thrombus. Sometimes with a low ACT, thrombosis will happen. So nowadays ACT is routinely monitored in zero flow labs, and this is another workflow like for VT right side ventricular arrhythmia procedures and the left side ventricular arrhythmias. Training and assessment of fluorous catheter ablation operator and facilities is required. Is a very important issue. So we, with the Chinese Heart Rhythm Society, organized a training performed a training program for trainees. So there are online training and offline training, and both of them available. So when we assess to make sure the qualification of the capability of operators, and also assess the lab. And so far in this year, 4 training classes were held in China. In-person trainees, we trained 134, and the online trainees 5,567 by October 25. This is pictures of different classes. And so far, 41 centers sent application for apply for the zero fluoro EP lab evaluation, and 37 centers qualified for assessment, and 124 operators apply for assessment, and 109 operators passed assessment and with certification. And what's the perspective of Green EP lab in China? I think that the future is very brilliant, because the workflow can guarantee objectively the safety and the efficacy of the procedure. 3D mapping system, ice and contact force sensing technology, and especially the PFA, the new energy. This energy can avoid dramatically the steam pop, which is a nightmare. It's sometimes unavoidable when we're using RF. So in the next year, maybe more and more operators will be involved in this field, and I hope it will help patients' care, and also will do good to ourselves. Thank you.